Welcome to Demystifying PANS and PANDAS, the podcast where we uncover the mysteries, breakthroughs, and hope behind these life-altering conditions. I'm Dr. Nancy O'Hara, a board-certified pediatrician, educator, and advocate with over 3 decades of experience helping children and families navigate the challenges of neurodevelopmental and neuropsychiatric conditions, especially PANS and PANDAS. These disorders can feel overwhelming, but here we'll break down the science, explore transformative treatments, and share stories of resilience and recovery. If you've ever wondered what's possible for your child or how to find answers, this is the place to start. Let's dive in. Hi, everybody. Dr. Nancy O'Hara, and I'm here to welcome Teresa Holler. Teresa is a tremendous clinician and friend of mine. She's a physician assistant who specializes in complex chronic illnesses. She is a fellow of the Medical Academy of Pediatric Special Needs and former assistant professor of medicine at Jefferson College of Health Sciences. She graduated from Touro College in physician assistant studies and Alderson Broaddus College with a master's in rural primary care medicine. She also completed doctoral coursework in environmental medicine and medical writing. She is the author of Cardiology Essentials, Holler for Your Health, love that, and On Medicine and Miracles, love that too. Teresa has been a speaker for the American Academy of Physician Assistants, North Carolina Integrative Medicine Society, Medical Academy of Pediatrics and Special Needs, and the Virginia Academy of Physician Assistants, and many more. She's been featured on NPR, Fox TV, Good Morning Arizona, The Dr. Jill Show, Advanced for Physician Assistants, and more. And recently, she became the Director of Clinical Education for Nutramedics, which allows her to do more of what she loves most, helping practitioners help people. And Teresa, I can't tell you how excited I am to have you join me on this podcast. I have learned so much from you and really appreciate you being here. So thank you.
That's humbling coming from you because I've learned so much from you, Nancy. It's great to be here.
That's what we do in this community, right? We learn from each other. We listen, we lead with our hearts, so I appreciate that, but I really feel that way about you. So, and tell me first, I know a little bit about you, but tell our listeners and tell me a little bit more about you and how you got to where you are today.
Sure. So I was taking a doctoral course in environmental health. And during that course, I learned about chemicals making people sick. And my first reaction to that was shock and anger because I felt like a big portion of my training omitted a big portion of what was making my patients sick. And that led me down to a rabbit hole and so many God-ordained things where I ended up at conferences and things like that. And everything was paid for by random people to show up at different things because at that point I felt like it was unethical to continue doing what I was doing. So as the breadwinner, I quit working and started studying and ended up starting my own practice, Victory Health. And when I started, I've never advertised at all. I started just word of mouth. And what happened is I ended up with a 1-year waiting list pretty quickly because I was known to be able to treat what other people just couldn't figure out. And I was sort of like the hope for lost causes in my area, and that spread word of mouth. And so then because I had to stop taking new patients, I remember, I'll never forget this. I had a woman come to the window holding a little baby, and she was crying and scratching at the same time. And she was just a total mess. And I was sitting at the front window because I had cut back at that moment. And I started to cry and I realized I can't not take new patients. And she had Morgellons, it turned out, and no one could help her. So long story short, I ended up just trying to move out patients that other people could help and then just sticking with the more complex. And then I entered the world of PANS, PANDAS, and brain inflammation, and then the kiddos, and here we are.
Wow. And where did Holler for Health come from?
That's actually because, my last name, I'm thankful to my husband for giving me such a cool last name, Holler. And I was mad when I wrote that book. It was all about environmental. And so that's where that name came from. And then, we all on our journey in life move through stages of grief. And then I came out with On Medicine and Miracles, where I started focusing on the miraculous turnarounds that I've seen in my patients with their health and their spiritual life. And that's where that book came from.
Wow. It's amazing how much, Sid always told me, Dr. Sidney Baker, one of my mentors, if you listen, they will come.
Yeah.
And, if you follow your passion, you're the breadwinner, but you give up everything because you were following your passion to help people. And look where you are today because of that.
Yeah. It was the
And I,
right thing to do. The right thing.
yeah,
Yeah.
exactly. And I also think, we've both come from conventional medicine and moved into functional medicine, and it feels right.
Yeah. Agreed.
So.
100%.
So, one of the first ways I met you was as the medical director, coordinator, and wonderful leader of the Lunch and Learns with NutriMedics. And you have such a practical approach of how to treat these children and these patients, and also how to express what we all need to do. So I am so grateful to you for that. And also want to tell all of our listeners, as practitioners, if you're looking to learn more about herbs, please set up a free lunch and learn with Teresa through NutriMedics.
Absolutely. I love that. When I was seeing the children and it's a hard job, and I was getting to the point where I didn't have adequate staffing and I really have no gifting for administration at all. And I was praying, and for about 7 months, like how to hold on, how to hold on. There's so much need here. And then I literally felt in my spirit the words, pass the baton. And at that point, when I let go of the practice, not knowing where provision would come from, just trusting the word, literally NutriMedics, it just dropped in their lap. And now I'm busy. I trained over 250 lunch and learns last year, plus speaking from the podium. And I love it because helping practitioners help people. And there is a great need. There's a lot of functional medicine practices out there. We all start somewhere and we start moving in our journey. And you can treat diet and lifestyle and toxins and hormones, and you can do all that, and you can make yourself a good living. And you could get a good percentage of people better in their health journey. But what about the ones who are so extremely ill that that's not enough? There aren't enough practitioners who care enough to do the hard work, because it's awfully hard. And so those are the people that we at NutriMedics want to support the most, those practitioners. And so I love that they give me the opportunity to do it. I don't have to talk about NutriMedics herbs. I just help them help people. I love it.
I'd like to thank NutriMedics for sponsoring this podcast. NutriMedics is a company specializing in high-quality herbs, botanicals, and nutraceuticals. They have formulated research-based tinctures critical in the care of children with tick-borne diseases such as Borrelia, Bartonella, and Babesia. But also important is that they are a company with integrity, with charitable purpose, and with a goal of helping clinicians care for the families in their practice. If you do not yet know about their practitioner support programs, their lunch and learns, check out more at nutrimedics.com. And thank you. It's a great program, and I highly recommend it. But some of our listeners may not know much about herbs. And just tell us a little bit about how you came to use herbs, and about herbs that have been tested in comparison to medications for tick-borne disease, how effective they are. Tell us from your perspective.
Yeah, I was at an ILADS conference, and I have a cardiology background. I actually wrote a textbook in cardiology and taught cardiology in PA programs. I loved cardiology. And so I've seen what happens when you prolong a QT interval and you throw someone into torsade de point and have to resuscitate them in the ER with the magnesium push. I've been there. So for me, I never wanted to do that. So when I heard all these combinations of antibiotics, I got really concerned because, and being a PA, I didn't have the same confidence as a doctor as far as, making a mistake, because there is bad things can happen. And I have a very low tolerance for that. And so I was sort of depressed. I left the conference, seminars, and I was like, I don't want to do this, but I know I have to help people with Lyme. And this is a huge burden, not just Lyme, but other pathogens. And in the exhibit hall, NutriMedics was there, and I learned that their mission statement was to donate more than 50% of profits. And they brought these herbs in from the rainforest. Well, they have odd names. They're not standard herbs. It's very hard to start using them if you don't know what they are. And so I had the benefit of skipping out of some lectures because I just didn't want to do it, and spending time learning those and seeing that they put clinical research in my hand, comparing them. For instance, cemento and banderol are two herbs you combine to treat Lyme. Cemento is a form of cat's claw that's not immune stimulating like other cat's claw, because there's two chemicals in cat's claw. This one is missing one of the chemicals, the TOAs, that are immune stimulating, which can counter the. So it is the best cat's claw for conditions like autoimmunity or PANS and PANDAS, where you don't want to immune stimulate, or post-COVID, et cetera. And so that was compared head to head with doxycycline. I mean, what herbs do that? Let's just take it on and see, can we do it? And what we found is doxycycline was known to double round bodies. You just take a spirochete and you throw an antibiotic at it, it sees it, it feels threatened, it rolls itself up into a ball, and now it's a persistent cell, round body. But when you looked at the cemento, it actually reduced the round bodies. That's my daughter. I should have turned my ringer off. It actually, anyway, it reduced both the round bodies and the active spirochetes, and so did banderol, which is Atoba bark. And so the two together were my go-to for treating Lyme when I left that conference. And I had a 95% success rate, not having a clue what I was doing, just twice a day for simplicity. And so from there, I started treating Bartonella, and I had a horrific success rate with Bartonella. It was about 50%, which 50%, in my opinion, that's 50% of people don't have to go to a doctor that does multiple antibiotics. The other 50% I had to refer out. But then I learned about why. You have to add another herb to it to increase efficacy. And now I do that, and the efficacy is much higher. And then Babesia has always been easy to treat for me, either with prescriptions or herbs. And now, of course, I do herbs when I see that they work just as well. That took me over 10 years to release that crutch of the the prescription antimicrobials, because they work so well, but they do come at a cost. One of them is $700, to prescribe to begin with, and then with the side effect profile and the microbiome, et cetera. So that's sort of how I landed on herbs. It's been amazing.
Right. And I think several things you said are so important. So first of all, when you say Lyme disease, for our listeners, that's really Borrelia. And although we talk about Borrelia burgdorferi, there's dozens of species of Borrelia. But as you said, the salmento, that particular form of cat's claw, and banderol, Atoba bark are so good and have research-based efficacy. And then I think the one you're referring to for Bartonella was adding Hatunia, yes?
Yes, Hatunia, correct.
Yes, yes, and love that. And then one of the ones that you taught me about that I think is so important and effective is stevia.
Yeah. So the stevia research is my favorite research to share, because there's two basic ways that Lyme itself, Borrelias themselves, become super difficult to eradicate. Of course, there's outside factors like mold causing immunosuppression, et cetera. But the Borrelias themselves, there's the biofilm and there's the stationary phase. The stationary phase, not a lot of people talk about. And so if you remember back, when we were doing basic medical courses, we know that certain antibiotics are bactericidal, where they can actually kill a microbe, right? Your amoxicillins, your cephalosporins, bactericidal. But some of them are bacteriostatic, which means they don't actually kill a bacteria. What they do is they block its ability to reproduce. And what that does is it takes several generations, right? Several birth cycles to reduce that microbe down enough where the immune system can kill it off. And so with stationary phase, what happens is when a microbe enters the body, it reproduces itself till it takes hold. When there's a substantial amount and it's got where it needs to get, it stops reproducing, it plateaus. And those can't be killed by most herbals or antibiotics. So there was a study done looking at how do we address the stationary phase. Nothing works. Doxycycline didn't work. Surprisingly, cephalosporins were very poor, even though they're not cephalosporins. We knew they wouldn't work. The doxycycline and
Doxies.
Static, sorry. Yeah. And so that's where the dapsone protocol was born, because the dapsone protocol uses that leprosy drug that was repurposed, dapsone with doxycycline and cephalosporin. Oh my goodness, like 3 drugs together. I didn't even want to do 2, but that killed the stationary phase a good percentage down. But the problem is, if you don't kill them all, they're going to start reproducing again, and you're right back where you started. And now the dapsone protocols went to the double, the quadruple, et cetera. Now they're pulsing. But stevia eradicated all of the cells. It showed no growth. So, whoa, right?
Yeah.
So I saw that study and I thought, why am I not using stevia? And what I found is when I was looking at PCR data after using it, if I used a dose of 2 dropperfuls twice a day, and I did it for 2 months, then the PCR data was coming back clear, and my patients were already symptom-free, but it was clearing out the PCR data. If I was using 1 dropperful, it wasn't always working. And what was interesting is it wasn't the Borrelia burgdorferi that was the hardest to treat. I've been doing that forever. That was going away, but it was the Borrelia recurrentis that was just.
Mm.
And what I found is that would correlate with like a 41 band on a Western blot. If I looked back, that would be the band. And then when I look at PCR data, it was Borrelia recurrentis. And then what I found is that the patients that were like 75% better from Lyme and really truly could have just lived that way. They're tired, but they're like, listen, I got my life back. It was the Borrelia recurrentis. And that's the one that's for me, was hardest to get rid of. And when I added the stevia, 2 dropperfuls twice a day for 2 months, I call it the 2-2-2 protocol. It worked, but not by itself. Only when I added it to the herbs that had already made them better. Leave them on board, add this to it. And that was a game changer for me. So stevia is one of my favorite things. Also, it reduces the biofilm, 40% all by itself. And all the viable organisms, the spirochetes and round bodies within the biofilm when combined with other antimicrobials. So stevia, it's a cheaper herb than some of the others. So adding it in, it has to be Nutrimetics. It was brand specific in the testing. The other brands either did not work at all or didn't work very well.
Yeah. Yeah. And I think several things from what you've said. I mean, first of all, as a pediatrician, I started out just using antibiotics, and I wasn't getting the success that I've had in the last 10 years in using herbals for multiple reasons. I mean, it killed me to be using these antibiotics on kids, but we were killing their guts. As you said, many were bacteriostatic and weren't killing the organism we were trying to kill. And then more importantly, we may be seeing the Borrelia, but I think, I know for years, I may have been missing Bartonella and Babesia in many children because we weren't accurately finding it. And now we know, at least in the Northeast, 41% of ticks have all 3. Borrelia, Bartonella, and Babesia. And think about that. If we were using antibiotics, that's a minimum of 5 antibiotics in a child. I mean, we'd just be destroying their gut and not getting them better.
And for no harm. If you can't find these things by lab tests, why would you put them on these drugs without proof that you really, really needed them? And so with the herbs, you can cover so many things safely. Mm-hmm.
Right. And so for everything I do, it's a risk-benefit analysis. So the risk-benefit analysis in using herbs is just tremendous. And as you said, one of the things I like about all of your teachings is you have the research behind it. It's not just your opinion. It's research-proven efficacy.
Correct. And then a lot of clinical experience, 15 years worth. Yeah.
Yeah, absolutely. So one of the things we talk about a lot, and I saw it a lot more when I was using antibiotics, prescription antimicrobials, than I do with herbs. But one of the things we do see is a die-off or Herxheimer reaction. Can you describe that to our listeners? And then what do you do to prevent and treat it with, tick-borne disease or other chronic infections?
So first of all, there's several reasons that you see symptoms that many people call a die-off reaction. There is legitimate die-off reactions, and then there's symptoms that people feel sick that they assume is a good thing that they're eradicating. The problem with that is some blends of herbs from other companies, not the ones that I use, put in herbs that are known to be toxic to the cell in the combination purposely. Because it causes symptoms, because it's toxic to the cell. So people think they're getting a Herx. So like, well, this herb's working because I'm getting a Herx. And that just makes me cringe. So the goal is not a Herx. The goal is that if you are increasing the dose, let's say I go up by 1 drop twice a day of all 3 herbs at once, or 2, depending where I am. And then when you have new or worsening symptoms, we're going to assume it's a Herx. Hold the line. When you back to baseline, go up again. When you back to baseline, go up again, and you stair step the dose up. But if you're not sure if this is a Herx, you can always just wait it out because the hercs will go away and, within say 72 hours, 3 days. And then if you're like, I do feel a little better than when I started. Okay. Then that was a good thing that happened. But if you're not moving in the right direction, then you have to really wonder, was that really a herx or was I actually hurting myself? The other thing is, if it lasts more than 3 to 5 days, that is more likely secondary porphyria, not a herx reaction. And that is horrific to do that to yourself. And I've seen patients of mine do that when they're super like, I want to get better quick and I'm strong, I can just plow through this. And that's not how it works, because slower, less collateral damage actually gets you better faster. And so what happens with secondary porphyria is you get so much oxidative stress from pushing so hard that then your body can't keep up with it, and it causes this vicious cycle. And that can set you back weeks to months. So that we don't want to do. So I try to educate patients, but you always have the pioneers, the cavaliers that will just push, and you have to just start over. But in any event, for the most part, how do I handle a herx? I try to prevent the herx by starting out with something called Bartonella. It's Bur, and then another herb, Panella, Pinella, and they're the same bottle, thankfully, it didn't used to be. And I add a full dropper full to each cup where I put the other herbs. And they all just go together twice a day, so it's super easy. And that helps because the Berber helps the lymphatics to drain better. The Panella helps the glymphatics to drain all your neurological toxins. And then, of course, if you have liver enzymes that are elevated, you have no bowel movements, then you add things like your milk thistle, your silymarin, or your magnesium, whatever's needed. But for general overall detox, that herb is amazing. And then if someone calls into the office and they really herxed, like they just went up a drop and the sky fell out. This happens, right?
Yeah.
You can't predict when it's going to happen. They take 6 full droppers of berberine on a full glass of water and call back in an hour. So that would be the equivalent of 1 dropper full of berberine every 10 minutes for an hour. When they call back, they're extremely more calm because they see that they're going to be okay. They're either all the way better or percentage better. And it just makes the job so much easier than handling panicked patients calling, because this is such a hard thing to treat if you push too fast. And sometimes that happens to everyone. When they get that one dose, they didn't know that was going to be the dose that does it. So
Yeah.
Bartonella, extra when you need it, and then add on if people are herxing. I had one patient, oh my goodness, he had Lyme. And he got elephantitis, he had it all the way up to his scrotum, everything. I sent him for labs, studies to rule out cardiac issues and vascular issues. They were all normal. It was just the Lyme die-off was so extreme. He was on 7 supports, not just berberine. He was on berberine, chlorella, glutathione, a whole bunch of things. And we got him through, and that was over 10 years ago. This man is not healthy. He owns a restaurant, eats whatever he wants, probably drinks whatever he wants, and takes nothing. No supplements, no herbs. I treated him for probably a year, maybe a year and a half, and I've never seen him since, except when I go out to his restaurant. And so as sick as he was, he made it through and never had to take another thing for over 10 years now. So
Wow. Wow. Yeah. It reminds me as you're talking, we're both lecturing at the Medical Academy of Pediatric Special Needs in March in Myrtle Beach. And I'm lecturing on Alice in Wonderland syndrome, which is that going down the rabbit hole where you see everything distorted, either too big or too small. And I now have many children who have that secondary to some kind of tick-borne disease. And it was interesting to me. I have one little boy. The family had no money. We were treating him with Nutrimedix herbs free of charge to try to get him better. I knew from symptoms, and we're going to go through that in a minute. I knew through symptoms he had, and where he had been traveling, both Borrelia and Babesia. So I was using Cryptolepis and Salmento and Banderol, et cetera. But I had been using Bartonella. He had this Alice in Wonderland syndrome for over 3 years. He was a little 8-year-old boy, and nothing that they had done before, medication-wise, anything had worked. He started on these herbs 3 months after going on them. All symptoms, at full dose, all symptoms were gone.
That's incredible.
So then again, no money. They really wanted to start weaning. And I thought, well, I'll wean Bartonella first because, obviously he's not going to have die off. He doesn't need it anymore. That was a mistake. His symptoms came right back.
Wow.
So 2 things that proved to me. 1, it wasn't just timing, as several of my colleagues wanted to say, well, he was going to get rid of it anyway. And 2, the strength of that Bartonella in, as you said, the drainage and the the positiveness that you can get from it can be so powerful. So that's a case, with your gentleman with elephantitis, I just was thinking about too. So
Bartonella is a game changer for practice management, because when you do that 6 dropperfuls over an hour as a standard protocol, before you personally have to call a patient back and get involved in so much, because it's so hard.
yeah,
You just don't have to. They're better, they're triaged. It's just okay. You're going up
yep.
too fast on your herbs, slow down, take more Bartonella, and if it happens again, we'll get you a sooner appointment versus a phone call after another phone call at the end of the day. So I love
Yeah.
it.
Absolutely. And we have to mention the other one from Nutramedics, which is my favorite, Avea, which I often use in a very similar way. A child has a flare with PANS or PANDAS, with an increase in those symptoms that we've been trying to treat, the anxiety, the OCD, the sleep disturbances, the eating disorders, whatever it is. And if I give them 10 drops an hour or 2 or 3 droppers in a bottle of water, in at least 60% of the children, the flare goes away. And that's one that I learned from you, but have found such success from. And I didn't know if you wanted to
I thought
comment.
I learned it from you, Nancy.
Well, I learned that it existed from you. I may have pushed the envelope on it because I was seeing such
You
great
did.
things.
And you know what's interesting? Avea, AVEA, is curcumin, liquid curcumin. It was studied head to head with fluoxetine, right? Which we know is a
Right.
prescription antidepressant. So we know with curcumin, sometimes it's hard to make sure they actually work, which is why they add black pepper to a lot of products. The piperine augments the efficacy because it doesn't work well, right? But this one was studied in vivo and was shown to work and have efficacy compared to fluoxetine. So we do know that it works research wise, and then you've proven to me it works clinically. I started using it more because of you. But you know what's funny is I forgot how much you love the Avea. I was thinking you were going to say Sparga. Have you been using that yet?
Oh, I have. Why don't you tell our listeners a little bit more about Sparga?
So I've always used Sparga for CBS mutations, right?
Yeah.
So you remember the methylation cycle, right? Homocysteine goes down another chute. It's called the transsulfuration or detox pathway. And it does that if you have a CBS mutation, it sits there at the gateway. And it's one of the few mutations that if you have it, it speeds up the enzyme rather than slowing it down. So that homocysteine sort of pours down there or wastes away down that pathway. So whenever I would see a homocysteine level less than 5, I would suspect they're wasting their homocysteine. Or if their creatinine was less than 0.5, I would suspect it. And I would put 10 drops just once a day on anyone. They'll get 10 drops. And then those numbers got back, and then they could tolerate their methylation support because their homocysteine was now able to be used again for methylation. So what's interesting is that's the only time I used it. And then I met a doctor at MAPS, believe it or not. I love all the doctors I meet, they're brilliant. And she treats autism, and she has a protocol that she uses because she treats patients who are refugees in other countries via the internet. She's incredible. I'll introduce you to her at MAPS.
Yeah.
Lovely, lovely woman. And she came up to me and says in her protocol, they're all getting, a standard group of things like glutathione, right? Something to treat the frat, some kind of folinic acid combination, whatever. She made her own product, which is amazing for that. And Sparga is the third. And I was like, why do you put everyone with autism on Sparga? She goes, it's incredible. I was like, I don't understand why you would do that. I use it for CBS mutations. Surely they don't all have that. It's also good for COMT mutations. Well, she said, well, the mutation's not the only thing that upregulates a CBS. If you're toxic, of course, it's the detox pathway. I mean, it's so simple, but I didn't ever get it. She's like, if you're toxic, you're going to upregulate and pour down that pathway. Now you can't methylate, you're all blah, blah, blah. So they all get it and they do so well with it. So Sparga, I'm using so much more of it now. If you're toxicity, any detox, 10 drops of Sparga, add it right in.
That's great. I need to start using it more.
Yeah, I know,
That's a
me too.
great
It's like
time.
I have
I
to
know.
read something new.
Exactly. There are so many out there. That's the thing. And I want to make this concise for our listeners and help them to see it. But it is very common for our kids with PANS and PANDAS. And this podcast is Demystifying PANS and PANDAS. It's very common for our children to have multiple infectious or metabolic triggers. It's not about the trigger, whether it be strep or mycoplasma or virus or any of the three Bs, Borrelia, Bartonella, Babesia, or mold, or COVID, or whatever it may be. It's about the immune tolerance and the lack of it. And I heard you say on another podcast that you called it the PANS tilt. Was that total immune loss of tolerance?
Yeah, I stole that from Dr. Singh. I love Dr. Singh. I heard her say it.
I love that. And
There's
and
such
talk
a
to
book.
about that a little bit more for our listeners.
Yeah, so it's total immune loss of tolerance. I mean, why is anything chronic? You know, in the old days, you got an infection, you either died or you got better, right? That's it. Why are things chronic? I mean, that's what makes people think we're quacks. There's no such thing as chronic infections. And now we've been doing this for 20 years. And now they're like, oh, yeah, they are chronic. We're seeing that. But why is there something that's shifted in the last 50 years or so in our immune response? Well, I mean, toxins have, and these microbes are more virulent and they create immune tolerance. And mold toxins create immune tolerance, right? And so the problem is if you're tolerating things that make you sick. It's not actually a good form of tolerance. So what we need to do is we need to take the toxic burden off of the immune response so it can wake up and see what it needs to do. And so that's why I like using products that do a lot of different things at once. So we don't have to use so much. One thing I love about you, Nancy, is that you and I both, you being from West Virginia, me getting my master's in West Virginia, we are practical and we recognize people have budgets and we want
Yeah.
to help use the least expensive, least amount of things that are going to move people in the right direction. I think detoxifying the glyphosate, the PFAs, they're everywhere now. And then just removing the toxic burden and using herbs that are going to not just kill a microbe, but they're going to modulate or rebalance the immune response and be an anti-inflammatory at the same time means you're doing three things with one herb. And if you're using Chinese skullcap, you're doing so much more, right? I mean,
Yeah.
and the other thing is the microbiome, right? Because the microbiome is such a big portion of the immune response and it has to be in good shape. And we know that Hatunia, which we use for Bartonella and viruses and long COVID, because it helps to modulate the changes there that need to be done. Hatunia and Chinese skullcap or Baikal, Baikal skullcap, both of those herbs are good for the microbiome in clinical studies. So they're actually helpful, not hindering. And then I was asked, well, what about the cemento and the banderol and all these other herbs you've used for Lyme? And I couldn't answer them because there's no clinical research. But then I remembered this patient, and I remembered so many patients, right, that I've never had to worry about the microbiome in all these years of treating this way. But I remember one in particular because this gentleman had autism and he was probably about 18 or 19 years old when he came to see me for the first time. And he was not able to attend, school or things like that, but he was super high functioning. And he came to me and he couldn't get out of bed and he was a hot mess and his gut was he was in so much pain and could not eat food. And he had been to so many Lyme literate doctors and had been on so many antibiotic combinations for all of his microbes. And he came to see me and I was like, let's just stop all this, settle, and we'll put you on the herbs one drop at a time.
Yeah.
And of course the candida, we had to treat the candida with herbs that are not going to hurt the microbiome. And I did use the cemento and all these herbs without the studies for microbiome, and he recovered and he tolerated them. And so it's just such an advantage to use things that are helpful or at least not hurting the microbiome along the way.
Absolutely. And the other one you and I both use a lot is modified citrus pectin along those lines, both for its galactin-3 reduction, but also, helping with glutamates and natural detoxification and gut health and everything else.
You know what's interesting is I just was doing research on PFAS this past week because of the firefighting foam, it's everywhere. And because where all the rivers are contaminated, drinking water is contaminated, and it's causing so much harm to the immune response as well as many other things. And one of the things that's helpful is inulin. Now, inulin, is the fiber that most of us don't get much of. I mean, it's in Jerusalem artichokes and foods we don't tend to eat. But what's interesting is that I also found research that ochratoxin A, we know that cholestyramine is one of the drugs we use to pull it out. And that was actually shown in 2 studies where people were occupationally exposed to really, really high doses of PFAS where they got acutely ill rather than chronic. And cholestyramine was the only thing that would pull it out. And what's interesting is we know chitosan is a molecular mimic of the well-call cholestyramine type of thing. And that we know that these things are maintained in the body because of the enterohepatic circulation, right? Where the bile is recycled and recycled. So what's interesting is I'm really planning to start using the Binder Plus now in all my patients for detox because it has the inulin, it's got aloe, it's got fulvic minerals, so very supportive of the GI tract, but it
Yep.
also has in it the chitosan, not from shellfish, so don't have to worry about allergies. And also activated charcoal seems to be helpful for the PFAs. So as we're talking detox, so, the things you're bringing up, I'm thinking that I'm going to start using more of that. Now, I use it for my mycotoxin patients, but I think we need to consider that everyone is exposed to these other things we don't test for.
Yeah,
So
that's a
just
very
a
good
thought.
point.
Just a
And
thought.
I have found a lot, especially in children, when we're using the binders, the cholestyramines, the Welcols, et cetera, the risk of constipation is so great. So either adding these other things like the fulvic acid, the aloe, et cetera. But I have also found these food-based binders like the modified citrus pectin have been so much more helpful in not making them sicker from getting constipated, but still cleaning them out.
Yeah,
So
and then throw a little inulin with it so you get the
exactly.
PFAs as well. And I think that that's something we need to start thinking about is pulling that out. So this is just something I haven't put this into a talk yet. You're the first one that's hearing my thoughts on this. Yeah.
Well, it's very apropos with all
I
you've
know.
been through in North Carolina and what's going on now
So
in
much devastation.
California. It's just devastating. So
Agreed.
our prayers and our thoughts go out to everybody affected now and people that have been affected for years from natural disasters. So
And our
anyway.
firefighters. We got to detox our firefighters.
Absolutely. Absolutely. That was my practice when I first started right after 9/11, all the firefighters and their family.
This is my
That's where
husband,
I
like,
started.
see him there, my little firefighter.
Anyway,
Yeah.
so let's take a step back. And I just want to talk for our listeners about the symptoms of Borrelia, Bartonella, and Babesia, the 3 Bs. Those are the biggest ones in kids that I think wreak havoc and should be looked at when we're thinking about PANS and, acute onset, subacute onset, or chronic neuropsychiatric disorders. So first for Borrelia, when you think about the top symptoms, what are you thinking about?
It's tough because Borrelia is everything. I consider Borrelia the broad background and just cover for because all the herbs that treat everything else treat Borrelia, right? So I feel like I'm always just going to cover for Borrelias because there's so many of them. But I mean, fatigue, people really forget that profound fatigue and weakness can be a symptom in addition to obviously migrating joint pain is classic for that. And then neurological symptoms. So I think you always just have to cover for it. It's so rampant and it's so devastating.
I agree.
It's
And
it's
and I would add brain fog of any sort, memory loss, trouble processing in kids, in addition to what you said,
yes.
absolutely.
And of course, if we're dealing with those symptoms, long COVID has to be addressed at the same time, which is why I like the herbs. Chinese
Yeah.
skullcap and petunia will help modulate those responses, and then we may need to do more, but that's a start. Yep.
Yep,
Agreed.
absolutely. And then Bartonella, the big things that you think
Oh, this
about.
one's easy. This is rage.
Yep.
I've had it. I had Bartonella. Oh my God. Anger and rage is crazy. So when you see someone, you know their personality, and all of a sudden they're going off the wall, just please have compassion. I've had it. Thank God my husband knew me before. It really is shocking. And then the striae, which is the streaking type of rash that doesn't go the way it should. If you gain weight, you have a pregnant belly and you gain your striae around the middle, they shouldn't go up and down. It doesn't make sense. So that is classic for Bartonella. And as you treat, you'll see that red purplish color, that inflammatory active Bartonella die down, and there'll just be this clear background after you get better. And then I would say lumps and bumps, right? Nodules, you can feel them in the arms and legs, behind the knees and the thighs, lumps and bumps. And
Yeah.
then, and plantar fasciitis, because these are unique symptoms that I'm mentioning that's not as prominent with other things. So plantar fasciitis, sure, you can have that from other reasons, but usually this is going to be first thing in the morning. As soon as you get off the bed, it hurts the worst. And so it's a little bit different. So those are
Yep.
the main things for Bartonella.
Yeah, I totally agree with you. And in kids, I often talk to parents, in most kids with PANS or PANDAS, it's episodic. One day they're okay, the next day or in the course of the day. But with Bartonella, I see it as a constant flare. And like you said, the rage and the anger and the aggression are self-injurious. And then the other thing, that plantar fasciitis in little kids or our nonverbal kids with autism or for other reasons, often what I'll find is they bunch up the socks in their shoes. And, it's seen as a sensory problem, but it's actually Bartonella.
Interesting.
So, and then Babesia, the big ones for you?
Air hunger.
Yeah.
Classic for Babesia because the mast cells are super activated. Remember, Babesia is a parasite. Parasites activate the mast cells like crazy. Mold and parasites activate the mast cells more than anything else. So Babesia will give you air hunger, which is a symptom of that.
Yeah. And then I see night sweats,
And
really
that's the other big one.
soaking the sheets. Exactly. And sometimes unrelenting headaches, that kind of elephant sitting on your head headache I see with Babesia. So
Agreed.
So thinking about these three, what's a simple approach to using herbs for tick-borne disease?
Okay. So I like to start with deciding whether Bartonella or Babesia is there. Okay.
Yeah.
And because those herbs have to be different. And if I suspect them and I want to go after them first or not. So sometimes I'll go, if I know they have Lyme and I don't suspect these other things, I just start with a Lyme treatment and then cover for those things at the end. And the reason for that is there's an herb called cryptolepis, which is super powerful and it works for all of them. It's going to work for all the Borrelias, the Bartonella, and the Babesia, but it tends to clobber my patients. So I don't want to start with that in the beginning. I want to try the Lyme treatments that I use. And then if they get better without it, I didn't need it. If they're not better, then I'll add it. But if they have Babesia, it's got to come in the beginning because Babesia, I use Chinese skullcap and cryptolepis, the two of them together, so easy. Start at 1 drop twice a day, work up to 40 for adults, maybe 20 for kids, 10 if they're little, 2 to 6, whatever. That's that. And then pulse in some artemisinin only if it doesn't work, but rarely do you need to do that. And that has to be done under very special care, or add Artemisia annua if you're checking liver enzymes. Okay, that's Babesia. Bartonella, I just love to just treat Lyme and Bartonella together. It's super easy. Cemento plus Nutri-BRT, right? Cemento for the Lyme, and you always pair it with something else. If I'm just doing Borrelias, I pair it with Banderol, and then I switch it out to Kumanda or vice versa, whatever. But if they have Bartonella or I'm covering for it just in case, then it's Cemento plus BRT. And always Chinese skullcap, because why not? It's so neuroprotective. It protects you from all neurodegeneration. It's good for anxiety, good for depression, good for cognitive function. It's so good for you. It's good for viruses. It's good for all the immune response. It helps with the long COVID immune changes. So if you put Chinese skullcap on board, you're covering for Babesia, right? You got your BRT, you're covering Bartonella. And you got
just remind everybody the herbs in BRT.
Okay, so BRT is Hatunia plus Kumanda. So when you're treating Bartonella, remember I said I just did so poorly in the beginning. It's because I was just using Hatunia by itself. Yep. But you have to add a second herb. Kumanda is one of the herbs I like to add to Hatunia to increase the efficacy. That's Nutri-BRT. It's all in one product. The other herb that works is you can do Hatunia plus cryptolepis, but again, it's a little bit more clobbering, so I use that if I need to. And then Sida acuta, but you have to watch for things like your thyroid and your blood pressure. So again, if you have to watch for things, I tend not to use the herbs because if the other ones work, why watch? But those are the options.
Yeah. And I think one of the things I want to highlight of what you said that I think is so important and that I've adopted since meeting you is that starting with 1 drop or 1 drop twice a day, starting that low, as you said, prevents or avoids the die-off. It helps them see it. They can increase it every day. I think that's a game changer because I think some of these families are just so overwhelmed. And sometimes even adding 5 drops on the weekend, which is what I was doing before you and I met, that causes die-off just there. And then they've had a miserable weekend. They go back to school. They don't know what they're doing. They can't get me because I'm not available on the weekend or whatever. But starting at that 1 drop, I think is so important. And building up as you do 1 drop at a time to get to the full dose.
Yep, I just call it drop by drop dosing. And then if you have new or worsening symptoms, hold the line until you're back to your baseline, even if it's not caused by that, because you don't know. these people, right? How sick are we when we have these things? Everything makes you sick. The weather changes. You stayed up later. Your in-laws came to visit. Not mine. Mine are wonderful. But
In case they're listening.
but anyway, so but even so, it's a stressor on the body. So why push up? Just hold the
Right.
line. The only exception of that is if you're not moving at all. If you're just like every day, you're like, well, there's a reason. Then try to move.
Right, right, exactly. And then one other herb that you and I have talked about before that I wanted you to mention is noni.
Okay, so noni, I'd love to hear your take on noni. And the reason for that is when I reviewed the literature on noni, I got confused because noni has some anti-inflammatory, some pro-inflammatory, and I just got nervous using it. It's a potent anti-inflammatory. It's moringa for those of you who don't know the other name. So I'm a little gun shy until I can figure out, am I only benefiting people? Tell me your thoughts on it.
Well, I don't use it very much, and that's why I was asking you because I thought you used it more. Since I've been using the turmeric products, the Avea, things like that, not only is it anti-anxiety, it's anti-inflammatory, as we know about
Right.
turmeric and curcumin.
Yeah.
And remember, everybody, if you're not using the NutraMedix product and you're not sure of how bioavailable your curcumin product is, that black pepper extract increases the bioavailability. But I have had such success from an anti-inflammatory, immune-modulating standpoint with that,
No,
and
I
a
need the
few other things, SPMs, essential fatty
SPM.
acids.
Yep.
I don't use noni because I did see it having effects that I thought were pro-inflammatory, and I
Yeah.
wasn't seeing. So it's nice to hear you say that. I was thinking you were using it a lot more than I was.
I was
So
thinking you were using it more than I was.
there you go. That's why we do this. We talk, we hash it out. Everybody else is listening, but it's just for you and me. No, anyway. And then one of the other things I love about you, I know we've been talking a lot about NutraMedix products because not only do we both love them, we know there's a lot of research behind them and we've had clinical success, but neither one of us just use that. And there are so many others, you've mentioned things like magnesium, NAC and acetylcysteine. But one of the things I love about your Lunch and Learns is you're not just talking about NutraMedix products. So for tick-borne diseases, any other products you want to mention now?
I would have said cryptolepsis, but now NutraMedix has it. I would have said Chinese skullcap, but now they have it. I would have said Sida acuta, but I'm not really using it anymore. So really, all my herbals, I think they finally nailed the product line that I need. I pushed for some for several years, and they're there now. So I just stick with NutraMedix for tick-borne diseases, but I have two giant shelves full of other people's products for everything else, and I talk about whatever's needed in the Lunch and Learns and when I speak from the podium, whatever people need. Our goal is to get people better and to do it as
Exactly.
cost effectively as possible and as stress-free as possible.
Exactly. Exactly. Well, I can't tell you, Teresa, how much I love your curiosity, how much you listen to your patients and the practitioners that you train. I love your heart. I love your practical approach. Do you have any final words, any words of wisdom or hope that you want to leave our listeners with?
Well, there's always hope. And, one thing I learned from working in the hospital in my cardiology job and walking out of the ICU and seeing people in there and just thinking they will never come out. And then the next day they're discharged. And you're like, how in the world did that happen? I just want to say I've seen hopeless cases get better pretty routinely. I've seen miracles happen. I've seen, there's always hope. And there's no such thing as false hope unless you're a shyster. Hope is hope, right? Let's base it on truth. But hope is hope. And that is the first step in healing. So if you don't have hope, find it.
Yeah.
It's
Yeah.
there, it's out there. Mm-hmm.
Yeah. Thank you for that. And just keep moving. Just keep hoping, praying, whatever works for you, but see the little gains, not just the big gains, but the little gains too, and find the joy in every day. And
I have to say one more thing based on that is that patients who are chronically ill and their parents, because it's just a hard road to go, they forget the gains they make. So I make them tell me in each visit, several symptoms that we're going to focus on, and then better, worse. And I quantify them. And then when they come back in hopeless, because it happens, it's hard. And I read it back to them and like, well, what about this symptom? Like, oh, I forgot I had that. What about this symptom? Oh, I forgot I had that. And then what happens is their hope comes back alive because they realize even though these 4 things are not better, look where I was, and they forget where they were because they're so focused on fixing the next thing. And so hope can come alive just from showing them where they've been and where they're moving. Baby steps sometimes, and sometimes big steps.
Yeah. And that's why the history is so important, so that you know the symptoms they came in with the first time. And we often use them on a scale of 0 to 10.
That's right.
Non-existent, 10 being the worst you've ever seen, just to help them quantify it too. Because you're right, sometimes they get so mired in the hopelessness and the despair that that hope makes that next step more possible. So.
That's right.
Anyway, thank you. Could you please let everybody know where they can find you?
So basically through NutriMedics.com, if they go to NutriMedics.com and then just send an email for practitioners to set up a lunch and learn with me, make sure they know you heard it through Nancy's podcast, because maybe you'll get ahead of the line a little, and because we love Nancy. And then, I have my own website, TeresaHoller.com, which is TeresaHoller. And then I am on Facebook at Victory Health Consultants, although I hardly ever post there, but if I ever do anything like a free anything that I'm speaking at, I do post it there. So you can look there. I'm just starting to do that. I'm very not tech savvy, but I'm going to start posting the links to all of these kinds of things, and you can find them there.
Great. Teresa, thank you for everything. I love your passion. I really appreciate you doing this with me. And everybody, if you haven't met Teresa, if you haven't heard her speak, come to MAPS, go to NutriMedics.com, go to TeresaHoller.com and meet her, see her, and you'll feel the healing just being with her. So thanks, Teresa.
Thank you, Nancy.
That's it for today's episode of Demystifying PANDAS. I hope you're walking away with insights, tools, and hope to help you and your child on this journey. If you found today's conversation valuable, be sure to subscribe so you never miss an episode. Share this podcast with anyone who might need it. It could be the lifeline they're searching for. And if you have a moment, leaving a review helps us reach even more families who deserve answers. Also, for more information, training, and community, check out our website, drohara.com, and join our annual membership. And remember, every step forward, no matter how small, brings us closer to healing and understanding. Until next time, be present, be hopeful, and we look forward to seeing you next time on Demystifying PANS.